Many clinicians assume that if we can explain something in simple terms and tell the patient everything we think they need to hear, then that is enough and that makes a good explanation. However, there are many other ways in which we can go about explaining things to the person in front of you that can really make a profound difference and make it much more memorable for them to take away. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator here in the UK. And today we're discussing how to explain things to the person in front of you. This could be diagnosis, it could be treatment plans, it could be prognosis, it could be anything, okay? But there are fundamentals about how we can go about explaining things to the person in front of us to make it more memorable, make it easier for them to understand, make it more likely they're going to take in what we're intending them to take in and take away. If you find this useful, please do share it with others. Please do subscribe. We're going to be going through several different things today. Hopefully you find it useful, so let's crack on. It can be very easy when you feel the need that you need to explain something to someone to immediately start rambling on about whatever it is you'll need to talk about. But before you do, the first step in any explanation process is to ask, what do you know? Because they may already know what you're going to tell them, right? It shows you're interested if you're finding out what they know. It may well save you time because they'll just tell you what they already know if it's correct. And it may give you an idea of any beliefs you may need to discuss or cover later on. It will also potentially save some frustration because they don't want to be told by you things they've been told by 3 other people already. So just find out, first of all, what do they know about whatever you're planning on explaining? And it may have all those benefits, okay? Here's an example. Saw a lady in the past with her widespread condition, and she said to me that she'd done tons of research, she'd seen several people, she had a good understanding, she taught me through what she knew, and I didn't have to explain much at all, right? We just got straight on with her treatment and what the suggestions were. Always find out what do they know first, okay? Because it will save you and the person in front of you potentially a lot of time and frustration. And then with that, let's say you find out how much they know. What do they want to know? Right? Because they may not want to know what you're going to tell them. Okay? They may not care about the diagnosis. They just want to know how they can get better, perhaps. Or they may not care about what the options are. They just want to know, what's going on, first of all. Okay? What do they want to know? It could be very specific. It could be very broad. But again, may save you time. And if you're giving more specific explanations around whatever it is, it's more tailored, it's building a better alliance and relationship with them. It's showing you care more compared to just giving out generic information. Again, an example, someone I saw very recently, she had another potential widespread condition going on, but she didn't care. She was quite happy managing it as it was, and she just had one question about one part of her body. Fine, we answered that instead. She was managing the wider spread symptoms, so we left it alone because it wasn't bothering her. And we can always come back to it later. But what do they want to know? Okay, those 2 things first before you go anywhere near opening your mouth and spouting whatever information you're going to say. Now, let's say they don't know much, okay? And they tell you whatever they want to know that they don't know the answers to. Okay, there should be ideally a back and forth and discussion, but people don't know what they don't know. Okay, they can't come in knowing everything about their problem. Okay, so they will have questions, and they may want to know, why has this problem happened? What is their diagnosis? What does it mean? How can we get it better? How does that work, etc. So you're going to be covering whatever topic it is, and the general rule of thumb is that whatever information you're giving should be easy and simple to understand. The more simple it is and easier to understand, the more memorable it's going to be. So keep it generally simple. The suggestion is the average person's the kind of reading or writing age of a 10 to 12-year-old. Now, this will be variable because for the average person, that's fine. But there will be some people who come in, whether they're have a background in this subject, perhaps, or they've just done a lot of reading around the subject before they've come to you, their knowledge level will be higher. They will be using more technical terms. So as I've said in the past, we talked about building rapport by using their language, right? Part of the mirroring ways. You can use more technical terms for those that are using more technical language with you. Okay. So a simple example, we had a chap previously in one of our programs who it's clear had done tons of reading. He'd done some, I think, a biology degree in the past. He had some more technical lingo than the average people we see. And so I used more technical language with him because I could relate and he could, in theory, understand. And it was more specific to him. So again, he felt he was being cared for more than just a generic average explanation. Now, that's a rare example. As I said, most people were looking for simple, easy, layman's terms, if you still use that term, language that they can understand. Whatever it is you're explaining, keep it simple. And as I've also discussed in the past, metaphors, okay? Simple analogies or metaphors that they can perhaps relate to, you can be specific to them, makes it again easier to understand. We've got a whole episode on certain clinical metaphors I use. You will have your own metaphors as well, regardless of whatever speciality you're in, okay? But metaphors make things easy to understand, providing that it is not scaring them or not setting a negative connotation, okay? Make sure it's a positive, right? We're trying to, whether it's resilience, strength, moving forwards, whatever it is, but it needs to be a positive metaphor, okay? And then you can use those. Or if you don't have a metaphor, you can have other options too, because some people, as I said in the past, are more visual learners rather than auditory. You can draw. So you go and listen to the clinical metaphors episode a few weeks ago. I had draw the cocktail analogy, okay? If you're discussing about a certain condition, is there a way you can draw it? Perhaps that makes it easier to understand. If it's related to a certain body part, can you draw the changes that happen perhaps? Or if it's for a treatment plan, can you draw out the options for the shared decision making? Whatever it is, okay? But make sure, again, that it's not scaring them. It needs to be positive, all right? I want them to come away with a feeling of support and encouragement, not fear. So again, that's option B. And option C, for some situations, you may actually have models, okay? It's classic to walk into the physio or orthopedic department and have models of shoulders, feet, knees, spines on the walls that you can talk someone through. Again, for the visual learners, can help them visualize a bit better. Great. But again, make sure it's a positive. You're not using to scare or fear. You're using it to support and encourage. The more you can mix up those options with the metaphors, the drawing, the models, whatever it is, the better. Now, one of the key skills in explanation, whatever you're going to say, should be in the form of what we call a chunk and check. So it's very easy when you're the clinician and you have a lot of information that you want to part back to the person that you can spout easily because you said it 10,000 times, to do it in one long spiel and go blah, 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 and get it all out. However, please don't do that. Instead, do it in chunks. We don't have a definition of how big a chunk is. It's variable. It may be a few sentences. It may be a paragraph. Depends on what you're discussing, okay? But whatever it is, please don't do it in one big blurb. Please do it in little chunks. And after each chunk, check the person you're talking to is following along or trying to understand. The classic is, can you repeat back to me what you've heard? Or a nice one by Kieran O'Sullivan is, if you're going to go home to your partner, parents, someone at home later, what would you tell them from what we discussed today? Now, I know it can be a bit awkward to say at first, okay? It does get more natural, it does get easier, especially if you don't do it in a way that feels forced. But if you are pressed for time, let's say, it can be very tempting to go, does that make sense? Yeah, is that what you got that? Yeah. Please don't do that. Because in a way, especially with a very firm, fast tone, they're just going to feel they have to go, yeah, sure. What we're looking for in those situations is maybe a, am I making sense? Right? Because whose responsibility is it to make sure that the explanation makes sense? Is it the patient's or is it you, the clinician? It's your responsibility, ultimately. So put it on yourself. Am I making sense in a nice, inquisitive tone is much more open to an honest answer than does that make sense? Okay. So I would say, as you're going along, if you feel you don't have the time to check the understanding after each one and am I making sense, it's a bit more nicer way of checking. It's not as ideal, but it's a nice alternative. And again, the key thing is don't do it in that one big spiel. Keep it in chunks and check along the way. And after each check, pause. Let them answer, okay? Allow that silence, as I said before, they'll want to fill it, all right? They may just say, yeah, no, I get it. Or they may repeat back just to make sure. Or they may say no, and they're not clear. And then you may have to elaborate a bit more. But after each check query, pause, okay? Don't jump to the next sentence because it may need a bit of time to contemplate what you've said. Now, finally, you're going to say whatever you're going to say. Draw it, use some models, metaphors, whatever it is. Now, we know patients don't remember everything we say. Hopefully, these things we've suggested today will make it a bit more memorable, make it more likely that the message you're trying to convey is the one they're taking in. But are there things you can direct them to, be it on paper, be it on a website, that they can go and look at to help enforce what you've said further for more information? Or most people you see these days will have one of these on them. They'll have their phone. And if you're in a private space and you feel comfortable with it, can you record what you're saying on their voice record on their phone? And then they can go and play it when they get home to whoever, just to themselves or whoever's at home with them. It's more personable, right? It's more specific to them. And to be honest with you, if what you're saying is correct, providing it's private and it's confidential, it's fine. Okay. So that is an option in addition to just directing to generic websites and paperwork. If you want to be more specific, more tailored to them, then having that phone recording may well help too. If you found this useful, then as always, please do go and share it with other people. Please do tell me what topics to cover, what guests to get, and any feedback that would make this better. Thank you for listening or watching as always, and I'll see you next time.